1 month ago, there were less than 100,000 cases of coronavirus across the globe. Today, there are more than 1 million. Let's explore those implications with Michael Marillier, who's been tracking the numbers for us. Good evening, Michael. It has been a crazy month, and there's been a real ripple effect. When is it going to stop?
Yeah, that's the question on everyone's lips, I think, Sally, and not just here in South Africa, but in countries across the world. We are calling it the corona ripple, because if you think about when you throw a stone into a pond, Sally, there is an initial impact, and then it just gets bigger and bigger and bigger. And that's what we've seen during the month of March. So let's explore the corona ripple, and I'll give you a sense of the key hotspots around the world. What's really interesting about this, Sally, is that you'll see most of those ripples or those red spots in the northern hemisphere. And I think the concern for South Africa is that we are set to enter flu season. We have spent most of this pandemic in summer or autumn conditions. You take a look at the northern hemisphere, they have been in the thick of their winter. And the experts say that could be a factor, Sally, in terms of the spread of the virus. So fingers crossed, as we enter our flu season, government is prepared to deal with it. But let's take a look at the corona curve, and we'll get a sense of how quickly we have moved from that figure of less than 100,000 all the way to 1 million cases. We actually hit that mark last night on Thursday evening. So, Sally, on the 3rd of March, we were sitting at 92,000 cases. Just to put it in context, 2 weeks later, the 18th of March, it had doubled to just over 200,000. A week later, Sally, it had climbed to 460,000 cases. And just 1 week after that, we were sitting at more than 900,000 cases. And, of course, last night, Sally, hitting the million-person mark. It's shocking and tragic at the same time.
Yeah, and that just shows us the curve and how quickly it rises. Bringing it home now, Michael, we've been under lockdown for a week. We talk all the time about flattening the curve.
Yeah.
And we are told by the health minister that cases have not increased as quickly as they've expected, but he's also warning us to be super cautious about that. What is the situation here?
Yeah, absolutely. Well, we'll take a look at the number of daily cases for South Africa in a moment. But first I want to focus very quickly on the global picture. So let's take a look at that, Sally, and you'll see how this ripple effect has just continued. So on the 3rd of March, the world was registering 2,500 new cases on a daily basis on average. 2 weeks later, it had spiked to 15,500 new cases. And then again, Sally, roughly 2 weeks after that, we were sitting at 75,000 daily new cases. Why is that significant? It's important because it means more and more pressure on the healthcare systems of countries around the world. So when you flatten that curve, we keep hearing that phrase, flatten the curve, it just means that there's less pressure on the healthcare systems. But let's focus very quickly on South Africa. What has life under lockdown actually meant in terms of the numbers? Well, this is the daily new cases, Sally. In the first few days before that lockdown was actually declared, and then the days that followed when we've actually been under lockdown. So take a look at that red bar at the top there, Sally. Of course, that's the 27th of March. That was the first day we were actually under lockdown. What's quite encouraging is that we have seen quite a rapid drop in terms of the number of daily new cases. Like the health minister has said, Sally, it could take as much as 2 weeks before we see the curve flattening on a consistent basis. But I think this is relatively encouraging. We've had a week of lockdown, and that curve seems to be heading downwards. For example, 43 new cases today. Much less than the highest number that we've seen, which was more than 200 on a daily basis. But let's focus very quickly on South Korea, Sally. I'm calling this the test case because South Korea presents some interesting lessons for South Africa. They imposed restrictions in terms of movement, but the key thing with South Korea, Sally, mass testing in the communities across the country. So they have a similar population to us, just over 50 million. But what they managed to do, Sally, was test hundreds of thousands of people. In fact, they tested 300 500,000 people when this pandemic actually began. And it seems that that's had quite an impact in terms of the corona curve. So I think, Sally, for Zweli Mkhize, South Korea is an important lesson in the overall picture of things. And just to put it in context, they tested about 4,000 people on a daily basis since their first case. South Africa is now averaging about 1,700 tests on a daily basis. So if we can ramp it up, Sally, it could make a big difference. Finally, I just want to remind South Africans about the tragic effects of this pandemic. In Italy, Sally, we've seen 14,000 deaths. That's the highest around the world. We've also seen around about 10,000 casualties in Spain. That's really spiked over the last few days, Sally, tragically enough, and they're really still scrambling to try and bring the curve down. We've also seen 6,000 deaths in the United States. I'm mentioning that, Sally, because it's the world's biggest economy. Anything that happens in the US has a ripple effect across the world, especially here in South Africa. And then finally, Sally, France, 5,000 deaths. That country also now struggling to deal with the fallout. So just a warning sign for South Africa as we get ready for that flu season.
Well, it certainly does seem like we are listening to the lessons from countries like South Korea, a strict lockdown, an early lockdown, and we're ramping up the mass testing. And that is the big focus right now. Thank you very much, Michael Marillier.